46. My testicles are painful and a bit swollen. I feel pain when I'm walking and I go to the toilet a lot of times. And if I delay going, I can even mess myself. Could this be prostate cancer? Is there anything I can do to check if it is prostate? Can I do a self examination?
The prostate is a internal sexual reproductive organ that is found just below the bladder, and the tube that carries urine from the bladder runs through the prostate gland. So as men age, there are two common conditions that affect the prostate. So the first one, like you have asked, is the prostate cancer itself, and the other one is enlargement of the prostate that is non-cancerous. We call that benign prostatic enlargement. So to be specific, prostate cancer is when abnormal cells arise from the prostate, and these cells are not similar to the other conditions that I've alluded to. They can spread, they behave in an abnormal way, like any other cancers that we know. If you look at the National Cancer Registry for 2020, they looked at the cancers, all the cancers that were diagnosed in 2020. About 27.1% of cancer, of all the cancers in men, it was prostate cancer. So this is the highest, the commonest cancer amongst men. If you rank it with other cancers overall, it's number 3. So the first is cervical cancer, breast cancer. Unfortunately, these affect women. Then prostate cancer is number 3. So it's quite common, and it's also the highest cause of cancer associated deaths. So it's a common condition that we see on a weekly basis in our practices. So majority of our population is we are blacks, and we are at higher risk of having this condition. So in this setup, it's very common. Prostate cancer can be asymptomatic. Most of the time, men have got this cancer in their body, and it has no symptoms when it's in the early stages. Then, as the cancer advances, there are some symptoms that may arise, and we call these lower urinary tract symptoms. Basically, what we mean by that is the cancer begins to obstruct the passage that carry urine from the bladder. So you get men having, when they have the desire to pass urine, they've got what we call agents. They have to go, when they have the desire to pass urine, they have to go immediately, otherwise they will spoil their pants. So this is one symptoms that may arise, and when they get to the bathroom, you find that there is a delay in the desire to pass urine, the actual passage of urine, and when the urine is coming out, it may have a weak stream. It's not shooting far off from the person, so the stream is weak, and they sometimes frequent the toilet, the bathroom during the day. Also, it can happen at night. They are frequenting the bathroom. So these are some of the symptoms that may tell us that there's a problem. They are similar to the enlargement that I've alluded to. So a person who has an enlargement and cancer can present with these symptoms. One can also present with complications, where for prostate cancer they can present with bone pain when the cancer has already spread to the bones. They can come with renal failure. They can present with bleeding, bloody urine. They can have many other complications, but these are some of the common complications that we see, and they indicate late presentation. Unfortunately, we commonly see men at this stage when they already have complications. So these are some of the different ways patients present. They don't have symptoms initially, and the cancer is there. They have symptoms of passage of urine, then they've got complications. So those are the three levels at which patients can present to us. So prostate cancer, the exact cause we don't really know, like most cancers that we know. But generally, it could be related to lifestyle factors that a person is exposed to. Then what we know are the risk factors. So we know that black man is at higher risk compared to other races of having prostate cancer. Then the older one becomes, the higher the risk of having prostate cancer. Then also family history of prostate cancer. If someone has got a strong family history, especially of early prostate cancer, they are at higher risk of having this condition and actually dying from it. So those are the critical factors that we have to look at. The race and black men are at risk. The older one becomes, the higher the risk, and the family history. So this can run actually in the family. If someone is diagnosed with prostate cancer, let's say before the age of 50, it's a bit too early. So it may mean that the brothers of that person or the children, so the first degree relatives have to be screened and checked of prostate cancer, because it may be running in the family. So one has to go and see a medical doctor for this condition to be picked. If we are going to pick it early, so it means men have to visit a doctor when they are still when they still don't have any symptoms. So unfortunately, unlike other cancers like breast cancer where one can examine themselves, prostate cancer, the organ is internal. So individuals or patients cannot do a self-examination of the prostate. They actually need to go to a doctor. They talk to the doctor, they are examined, and an examination which includes what we call digital rectal examination, where the doctor inserts their finger through the back passage and feel the prostate. They may feel and characterize it, whether it's suspicious of cancer or not. Then if it's suspicious of cancer, other tests may be ordered, which may include a test called a prostate specific antigen. So if everything is suggesting cancer, the doctors may go ahead and do what we call a prostate biopsy, where we are taking samples from the prostate and they are processed, and a result will come and tell us whether there is cancer or no cancer. So this is the process of diagnosing cancer. Unfortunately, the doctors are involved throughout the process of making a diagnosis. So it takes men. They have to come when it's early and they don't have any symptoms, for us to be able to pick what we call organ confined or early prostate cancer, which has a potential to be cured. The treatment options depend on the stage. The first stage, where the cancer is organ confined, there are several options. So there's no one option that is available, and there are many factors that determine which option is chosen, which include the characteristics of the cancer itself, the patient factors, which may include how fit is the patient, are there other competing diseases, what we call comorbid conditions that are threatening the life of the patient, and also the life expectancy of the patient. So before we choose which option we give for that organ confined cancer, we look at those factors. So the options may include an operation to try and remove all the prostatic tissues and remove the cancer as we do that. That's one option that's available. That's for localized cancer. Then there's also another option for radiotherapy, where radiation is used to cure the cancer. There are different options for that. Then for disease, for the cancer that is low risk, some patients and the doctor, when they discuss, they may agree not to actively do anything, but to monitor, because not all prostate cancer is going to kill the person when the diagnosis is made. So there's what we call active surveillance. Then for those that are not fit for any kind of intervention, and we may do what we call watchful waiting, where we don't do anything, we just continue to monitor them. For example, I've alluded to those that have got competing comorbid conditions. Someone has got a terrible heart condition. They cannot go under an invasive procedure. We may just monitor them and not actively do anything. So those are for the localized disease. Then we see patients who come at an advanced stage. So there are options that are also available for that, that we tailor-made for each individual patient. But generally, we try to withdraw male hormones, because we know that this cancer is driven by testosterone, or the male hormones that we find in the body. So there are different options that we offer when we are trying to remove the hormones. We can do it surgically by operation, where we remove the testicles. Unfortunately, most men don't like this kind of operation, but we know that the cancer will shrink and the symptoms will improve. Let's say they've got bone pain. We know that the bone pain is going to improve. If they have adrenal symptoms, they may also improve after this kind of operation. But if one doesn't want the removal of testicles, there's an option of injections that will have the same effect, where the hormones will drop. Then the cancer will respond. Of course, there are side effects associated with this kind of treatment. We also have chemotherapy, and also we try to deal with for the cancer that has spread, particular symptoms or how the patient comes. Let's say they come with the urinary passage has been blocked by the cancer. We may take them to theatre and create a passage through an operation to try and improve the quality of life of that patient. So treatment generally depends on at which stage a person presents to the hospital. Unfortunately, because men don't seek early medical attention, they don't come to hospital until they see symptoms. We are seeing patients at an advanced stage. I think generally what I would say is I would encourage men to adhere to good lifestyle principles like good diet, avoid smoking, avoid drinking. These are generally some of the things that are associated with cancers. So that would be the advice I would give men. But generally, this cancer, these risk factors, some of them we can't really modify them. Like if you are your race, you can't change it. Your genes can be changed. Then age, everyone just catches up with age. So there are some factors that are risk factors that we can't modify. But the lifestyle, I think every man can try to change something about their lifestyle. There are some people who have tried to talk about it, but you know, this prostate gland is very useful, especially when one is still young and they still want to have children, because it produces about 20% of the semen and produces important chemicals that are needed by the sperms. So, what a prophylactic prostatectomy is not really recommended. I don't think there's any benefit for that. What I would recommend is early screening, where one goes to the doctors and they are screened whilst they are still healthy, especially if you have a strong family history of prostate cancer. I think there's benefit for one to go for early screening, which may start as early as, in some people, as early as 45 years. But generally, screening, we recommend it to be done for those that are between 55 years and 69 years. That's where we have the maximum benefit of screening. After that age, there might not be much of benefit of screening. It may be too late to go for screening. And below that, for those that are not at higher risk of cancer, there also may not be any much of a benefit having early screening. The screening process involves the doctor having a conversation with the patient, and also involves examination, a thorough examination, which includes a digital rectal examination, where the doctor inserts their finger in the back passage and tries to characterize the prostate. If there is suspicion of cancer, tests are done, further tests may be done. Even if there's no suspicion, if you are fit in the age group for screening, a blood test may be done, which is called a PSA, a prostate specific antigen. So if all these factors are pointing to cancer, they may be need for what we call a prostate biopsy, where samples are taken from the prostate. So at this stage, that's where there's a risk of complications of this procedure, because it's an invasive procedure. Uh, so one, of course, the complications are quite low, maybe around 1%. So one can get blood in urine, or they can bleed, they can get an infection. Sometimes they can get into what we call urinary retention after the procedure. So, but the complications are not that common. So the screening for those that are in the correct age group, they or those that have actually symptoms, they can also seek medical advice. But if screening, that's when someone has no symptoms, and our aim is to pick cancer at an early stage, so they can go to their general practitioners who can start the process of screening. So the general practitioners, they know how to initiate the process of screening, and this can be completed at specialized hospitals where they can go ahead and maybe do a prostate biopsy. Usually diet, we use diet as to prevent a lot of other diseases. So my encouragement is for those that don't have this cancer, or that have the cancer, the diet that I recommend is a balanced diet that has correct nutrients in their correct quantities. And as men, my encouragement is for correct, to watch out the calories, avoid a lot of sugars or simple sugars in their diet, avoid a lot of fat in their diet. People have talked about fat, a lot of fat in the diet also as a possible cause of prostate cancer, but of course the evidence is not that strong. So a healthy diet is recommended for everyone, for those with cancer or without cancer. But of course, those that are ill need it even more. So I've seen people trying a lot of other treatments, like going for, I'm not against herbs, but going for other treatment options that may not really help them. There's need for one to get adequate monitoring from health professionals, and this monitoring will determine whether the disease is progressing or it's causing new like problems in the body. And the patient is important in the management. In terms of decision making, they should actively be involved in choosing what is going to be given to them and what kind of treatment they are going to receive. Unfortunately, most men in our setting, they are a bit passive. They wait for the doctor to just prescribe and tell them what they are going to get. But I want to encourage them to participate in making a decision on what they are going to receive as they get treatment of prostate cancer, because every treatment option comes with its own downfall or side effects. So the patient has to be able to accept those side effects and maybe understand them and live with them after. My advice is to encourage men to seek medical attention early, even before they have any symptoms. Men have got a tendency of not waiting for complications for them to go to the hospital. And with this kind of cancer, which is actually the commonest cancer in our nation, we find that men come at a late stage. So I want to encourage them to to seek medical attention even before they don't have symptoms, which may include screening for those that are within the age group for screening, or those that are at higher risk of having prostate cancer. With a strong family history of prostate cancer, they may need early screening. So for those that have got this kind of cancer, prostate cancer, there's also hope for them. What I have seen that keeps men with prostate cancer going is a positive mind, the hope within, and also when they go and discuss with their medical doctors and actually participate in decision making in what kind of treatment option they are going to pick. I see men going very far. So there's also hope for those that have prostate cancer. You can live with it, you can survive with it. It's not a death sentence if one has been diagnosed to have prostate cancer.